Okay, folks out in Zoom land, let me apologize that we're starting late and well, waiting for maybe one other committee member at least to show up so that we can have a quorum. Please bear with us.
You want to move yourself?
All right, we're going to start in just 1 minute. I'm giving these committee members just one more minute to show up.
They didn't make any.
Okay, all right. I'm going to call the meeting to order at 7:30. Again, I apologize for starting so late, but at this point, we only have three of our committee members, but we will persevere. It's really unfortunate since we have two very important presentations, which I wanted all of our committee members to hear. So a meeting is called to order at 7:30. I'm joined by two of my committee members, Darlie Cornell and what's that?
Hello.
Oh, hello. Yes, hello, Darlie. Hello, Darlie. What? Yeah, what? Yeah.
Getting into.
Yeah.
Stay on track.
Hello. Well, yeah, wasn't that a Broadway show? And Rita Hamburg. And so with that, we do have our usual pretty full agenda, and we'll start right away. Want to thank Martha Alexander for being so patient and for coming here in person, data communications outreach analyst with the New York City Department of Health and Mental Hygiene. And she really has a pretty significant presentation to make on the latest update on the community health profiles for Washington Heights and Inwood. There's a lot of very interesting information contained within this health profile, and it's a document that we're going to be referring back to time and again as we talk about our priorities for this district. We're going to, this gives us a standard of measurement as to what the issues are in our community. But actually, before I get to Martha, I need just another little moment here, because I usually start out by talking about what are the June health awareness. June is considered to be Alzheimer's and Brain Awareness Month. It's Men's Health Month. Oh, thank God. Finally get some men's health here. The National Cancer Survivors Month. It's a National Safety Month, National Migraine and Headache Awareness Month, Scleroderma Awareness Month, National PTSD Awareness Month, National Aphasia Awareness Month, Cataract Awareness Month, World Blood Donor Day, June 14th, Men's Health Week, the week ending Father's Day, World Sickle Cell Day, National HIV Testing Day, June 27th, World Sickle Cell Day is June 19th, Juneteenth. That's probably not coincidental. And then, as I mentioned, National HIV Testing Day. So there's a lot going on in June. But there's also a lot going on in Washington Heights and Inwood. And Martha Alexander is going to help us find out what are the big health issues and what are the various other measurements and data that the health department has relied upon as it determines the services that are needed in this community. So, Martha, the floor is yours. Do I have to give you the laptop? Yeah, you can have it. Yeah.
Thanks everyone for having me. I actually live in Washington, Inwood, so I wanted to come in person.
Fantastic.
I probably will not visit other community board health committees in person, but
Oh, so that's what makes it so special.
Right. And really my job is, I consider myself a cheerleader for all our data resources online at the health department, which includes data tools and publications. So really, I just want to, if nothing else, I want to leave you with the email address for our community health profiles or the website and that handout. Hopefully you can also maybe distribute by email that one, and it has links to all of our information because there's a lot of data, a lot of information that you'll want to have access to.
Absolutely. And I'm
Yeah.
going to ask that the handout and the other sheet be distributed to all 50 of our community board members.
Great, okay. And also I could take us, I could take a short amount of time if you need, but basically I'm here to talk about what are some of the updated data for the community and then how to find other data, other information.
Very good.
Okay, let's see. Oop, here we go. So, and then, yeah, I shared things. We know that a lot of the inequitable health outcomes across the city are due to structural inequities, racism, history of redlining, and other policies that have really led to inequitable outcomes. The citywide average life expectancy is 81.5 years. Washington Inwood is actually doing better than that, 84.5 years. But there's a really broad range from 75.1 years in Brownsville to 89.9 years in Woodside and Sunnyside. So actually looking at all the data, Washington Heights Inwood comes out kind of in the middle on a lot of things. As a if I can generalize, but when we look at Washington Heights and Inwood compared to Manhattan, it might be one of the
Right.
more at risk neighborhoods. A few things I want to make you aware of. We have a lot of publications. The health department staff write a lot of publications. We do a lot of surveys. We collect data via birth certificates, death certificates, disease registries, and there are just a ton of publications, both sort of short, a few pages long, and then some are special reports. I put a few examples of recent publications: mental health and substance use behaviors among public high school students. There's a survey every 2 years of high school students. The food retail environment in South Bronx, which is sort of looking at what's available for folks. And then postpartum paid family leave, so a different tax sort of looking at laws, like how the legal environment affects health. Then a couple of recent special reports. We collaborated with the Department of Homeless Services on health of homeless people experiencing homelessness. There's a summary of vital statistics every year, the births and deaths. And I don't know if you've ever looked at that. It's 80 pages. It's really, you can get very in depth. And then there was a special report a couple of years ago on the health of New York City children. So these are just some examples.
But the most recent summary of vital statistics is 2023, is it?
That's right, yeah.
Isn't there a more recent one?
No, this one came out in December. It takes a lot of time to finalize the data. We do have now an online tool that makes the 10 most recent quarters of vital statistics data available. Those are considered provisional, so they're not finalized, but we finalize it, by year. So
I'm sorry, is this the document that I usually look at least once a year on to look at the numbers of people diagnosed with HIV in Washington Heights Inwood? Is this the one?
That it would have deaths.
Deaths. Deaths. Okay.
Yeah, there is an HIV annual report as well.
Yeah, but I think I look at this one, I guess, for the report on deaths.
Okay, yeah. And then, we did put out a report on immigrant health last year. I don't know if anyone saw this, that we were actually really happy to work with an artist based in, she works in Harlem and is from the Haitian diaspora. Anyway, who made the cover art. But a few things that we found were that immigrants have higher life expectancy than US born New Yorkers, but were nearly twice as likely to lack health insurance. And then just really thinking about how immigrants make up half of the city's workforce in a lot of areas, healthcare practitioner, technical occupations. And then we looked at how structural barriers create obstacles to health. So this is available at nyc.gov/immigrant health, along with a lot of other resources on immigrant health. And of course, this is important in our neighborhood. And then a few interactive data tools. So this is where you'll want to go to look for, if you're exploring data. I always say first look at the publications, if you have a question, you can, but then we have a few different online data tools to look at our data online. The community health profiles are kind of the most accessible, the most curated data. There's about 50, 60 health measures that we put together to say this is what we think makes the health of a community visible. We also have EpiQuery, where you can analyze and visualize a lot of data from surveys and some syndromic surveillance, which actually comes from hospitals, and vital statistics. The Environment and Health Data Portal is a third large data tool and is really, I just call it a lot of fun. It's very visual and a lot of good information on all the ways in which the environment affects health.
Well, we should really be looking closely at that one.
Yeah, yeah, just when you have some time. I don't know if you all ever used the community health profiles before. Remember
yes.
these booklets?
Yes.
Okay, so they are really evolving all the time. Started in 2000 as a sort of a black and white, like Xerox stapled, and then around 2015, it was actually Dr. Mary Bassett who sort of reignited the community health profile. So let's redo these. Let's do them again. And so then they started adding more social determinants of health, more social community aspects. So it's not just like test results. It's actual how many bike lanes do you have, and what things make it possible to have health in your community. In 2020, we released an online version. So that's what I'll be telling you about today. It's very easy to access at nyc.gov/health/profiles. And all the information that you used to have in the booklet is online with a few cool new features.
But
Yeah,
you'll be talking about a more current version than 2020, no?
correct.
There's a new-
2022 today. Yeah, I just want to make the point, like a lot of people even have said to me, oh, I didn't know they were not the booklets anymore. So I want to make sure that everyone's clear.
But the previous one that I've been looking at, is that the one from 2018?
The last time we made a booklet was 2018,
Okay.
but
So
we
yeah.
put it online in 2020 and then have been updating the data about every 2 years.
Oh, wonderful. Okay.
Yeah.
I'm still looking at the one from 2018.
Okay, so now you know, which is great. Yeah. Yeah. I mean, the other day, my colleague who sits next to me said, oh, where are the booklets? And I said, oh no, I haven't done my job. Like we're online. But what you can do with the app online is you can select a neighborhood, of course. You can compare it with the borough average and the citywide average. And then you can select another neighborhood to compare. So Washington Heights, you might want to compare, we can compare it to neighborhoods in the Bronx. We can compare it to Upper West Side. You can also download and print the report. You could print one page to bring to your community board meeting, is what I always tell people, or you could print the whole report. So I did put together a few highlights of the data, if we have time for that.
Yeah, absolutely, yes.
Okay.
That's why you're here.
Okay.
Yeah,
Good to
that's
know.
why you're here.
All right. Okay, so hopefully, great. And also I left a few cards, and the email address here is on the front of this presentation, query@health.nyc.gov. So you can always email us with questions. So basically my job, like I said, is to get the data to people. So whatever question you have about data, I'm happy to answer it.
You're gonna be sorry you made that offer. Okay.
It's my job. I mean, I'm happy to do it. So the way the way the profiles are set up, like I said, we look at social determinants of health. So it sort of starts with what are the factors in the community that make health possible, and then goes to sort of individual behaviors. But we know that because of the history of racism in the city, it's not just our individual behaviors that are affecting our health, right? So a few demographics. There's the population of the neighborhood, almost 200,000 people. We always ask the question in our community health survey, how do you consider your health? Is it like poor or good or very good or excellent? So about 3/4 of residents in our neighborhood are saying their own health is good, very good, or excellent, which is a little lower than the citywide average. 43% of residents were born outside the US. The citywide average is 36%. And then 31% of residents have limited English proficiency, which of course affects ability to access healthcare and all kinds of resources.
The population figure, the 186,000, that's that's updated in 2025?
Correct. Yeah.
But it's not based on an actual census. I mean, it's got to be it's an estimate, no?
It's an estimate, yeah. From intercensal estimate, we call it. So between.
I see. Interpolated intercensal. Okay.
Yeah. I mean, population estimates are something that will be different on different sources.
Yes, okay.
But this is just to give a suggestion of how they compare to other neighborhoods.
So,
what?
And do you know, does that represent an increase from the 2020 census? Do you know?
I'm sorry, I'm not sure.
Okay.
We don't look at trends in this. I just realized I didn't share the screen. Is everyone okay online?
Well, they're not seeing what we're seeing right now?
I don't know. Are you? Hello? Anyone? I think Paula had said
We're
it would
not
have.
seeing the screen. We can see you all.
Okay, well,
Oh, no.
sorry about that. Thanks for speaking up. Let's see. Where would-
You have to do that,
Oh, yeah, maybe,
and then the arrow.
right. Sorry about that, folks. Here we go. Ta-da, okay. All right,
Okay, they should be able to see it now, right?
yes,
Okay.
okay. Apologies, so we're going through, and I did share the slide deck and another handout with, Paula. So hopefully everyone is getting a copy of it. The next measure, and these are just like a few little highlights, right, from the profiles, but we looked at poverty and unemployment because living in high poverty neighborhoods, of course, limits healthy options, makes it more difficult to access healthcare and anything you need for health. In Washington Heights and Inwood, 17% of residents live in poverty, compared with 20% in New York City residents, so it's similar.
Yeah.
And then, but unemployment is higher in our neighborhood than the citywide average.
I would have thought the poverty rate would be higher.
Me too.
Yeah,
Okay.
yeah. One factor that really stuck out to me was that our neighborhood is among the highest citywide for maintenance problems and renter occupied homes. So really, with the recent fire on Dyckman Street, it really,
Yes, yes,
I know we learned a lot about that building
right.
in the days after the fire. So this really stood out to me that we're among the highest citywide for maintenance problems. These,
Well, we'll have to show this to the people in the other room holding the
oh,
housing committee.
yeah.
Yeah.
I mean, it all comes back to health, right? Like
Yeah,
everything
yeah.
is connected to health. These data are actually from the Housing and Vacancy Survey, which is done every
Yeah.
3 years, I
3
think.
years, yes.
Which has a lot of interesting information. So that's maybe they're looking at it in that committee, but yeah. We also look at maternal child health, so pregnancy and birth. We do have a higher rate of expectant mothers who don't receive prenatal care or get late prenatal care. So 10.4% versus 8.1%. And then we do also have a higher rate of preterm births, which is 3 or more weeks before the due date. So both of those are higher
Wow.
than citywide rates. Yeah. As far as access to healthcare, 10% of adults are uninsured citywide, and our neighborhood was similar to that. And 15% of adults said they went without needed medical care in the past year. I did note that like our rate is similar to citywide, but then Morningside Heights and Hamilton Heights, it was among the highest rates citywide, which really stood out to me.
Really?
Yeah.
Morningside Heights?
Yeah. So it's just always interesting when community boards right next to each other have very
Yeah.
different outcomes.
Well, when you say Morningside Heights and Hamilton Heights, yeah, I gather maybe what you're actually referring to is all of Community District 9.
Correct.
Yes, okay.
Yeah.
So it's not, when you combine all of District 9 as
Mhm.
opposed to just Morningside Heights. Okay, I got it.
Yeah,
Okay,
I should
got
have said, sorry, these are
it. All right.
by the community health profiles are done by community district, which of course
Right.
makes it easy to talk to you about this.
Yeah, sure.
But
yeah.
what we named the profiles, don't always line up with what we
Yeah.
consider their own neighborhood to be.
Right.
Of course.
Yeah.
Yeah.
But it's not as though if you look at Morningside Heights separately, that it would have a higher rate of adults without needed care. It's the fact that it's part of this larger Community District 9 that gives us that higher
Where
rate.
does that extend to?
It goes from 110 to 155th Street, along the west side, directly below our district,
Mhm. Yeah.
and including the City College area.
Mhm. Yeah. Looking at a few chronic conditions, just sort of health wise, all of these were similar to the citywide rate. So
Really?
obesity, diabetes, and hypertension. These were similar to the citywide rates, which is interesting.
Really, I thought ours would be higher.
Yeah, I mean, it could be like you're saying, a situation where you're thinking of sort of individual parts of the district together, it comes to sort of an average. Yeah. But these are still pretty significant
Yes.
issues, right?
Absolutely, yes.
Yeah,
Well, you think 30% of all adults are obese? That's pretty sad.
right, and
Yeah.
a third have hypertension as well.
Yes, yeah, right, God, yeah,
Diabetes.
yeah, absolutely.
Right, right.
1 million New Yorkers have diabetes. That's
Yeah.
incredible.
It is, yeah.
That's incredible. 1 out of every 8 New Yorkers has diabetes.
Mhm.
Yes, so pre-diabetic.
Oh, God,
Right, right. That was a big campaign too, right?
yeah,
Okay. So those were the data highlights I pulled out.
okay,
Yeah. We could also, the rest of the slide deck is sort of tips on how to use the application, you know, how to find it, and then like how it's organized and how to navigate it. So I won't.
okay, so the full health profile is available on the website.
Correct.
So, so we should spend some time as individuals going through that and gleaning some information, you know, and especially come September and October, when we're thinking about our budget priorities, we should be paying attention to those the statistics in that health profile. And I'm going to suggest that all of the committee board members look at it.
September, you said?
Yeah, September, October is when we have the task of setting budget priorities for our overall district.
Mhm.
And this is information that's very useful in terms of helping us reach those decisions.
Great. Okay, good. That's really helpful to us because we're always kind of thinking about who's using these profiles, you know,
Yeah.
what's,
Okay, well,
what do they need it for?
yes, well, this is one way. I mean, this is definitely a useful thing, a tool.
Great.
And I would hope that every community board takes advantage of it.
Yeah, we hope so too. I'll show you quickly how to get into the profiles. Again, I went to nyc.gov/health/profiles, and then there are 2 steps to enter the profiles. I'll actually maybe zoom out so it's easier to see everything at once. But first you choose a neighborhood and then you select a section, so like a topic. There are 3 ways to choose a neighborhood. You can hover over the map and you could select from the list, and they're sort of they're alphabetical and then by number, or you can enter an address. So this is great for community members who do not know which community district they live in.
Right.
So first, I'll select our neighborhood.
Very good.
There's a little error that pops up, this map error. You just have to click the X to, so it goes away. And then we can select a section. So these line up with what we were just looking at, the who we are, demographics, social economic conditions, housing and neighborhood, maternal child health, healthy living, healthcare, health outcomes. And there's also a notes section that will have information on what are the surveys, what are the data sources.
Well, for the heck of it, click on healthcare.
Okay.
Let's see what that is.
Yeah, this opens up to sort of subtopics: access to care and avoidable hospitalization and vaccinations. So we'll look at access to care.
Right. I think our Presbyterian hospital people would be interested in this.
Absolutely.
Like, I hope so. Yeah. Okay. So, so here we see, just to show you the sort of navigation of the page across the top, those topics are listed again. These are all clickable. This is where you would go between the topics: social, economic, housing, and neighborhood. And then, so for each sort of health measure, there will be a sentence, and then it will be in a visualization. So on this page, it's on a table. So we have the health insurance again, adults without health insurance, and then adults without needed medical care. We can, if you scroll up a bit, you can choose a comparison community. So this is where I was looking at the Community Board 9 and what, how it looked compared to the others, you know, that 22%
Wow.
went without needed medical care.
Versus our 14.
Yeah.
That's
Surprising.
Mhm.
it is surprising. Yeah.
Yeah. I mean, they don't have a hospital right there, right?
Well,
But
yeah.
it's I mean, health insurance related.
Well, no, well, they do have,
to the hospital.
They have the Mount Sinai Morningside, what used to be St. Luke's.
Right. Yeah. So, I mean, there are many factors, I guess, that
Yeah.
influence health. Yeah, then a few other, the way this looks, then there'll be a few other measures. We have avoidable hospitalizations that could have been prevented if you had been getting, acceptable primary care. And then, so the way these look is that the citywide average is in the vertical line. And then the borough, the neighborhood we chose, and then the secondary neighborhood. So we can see that Washington Heights and Inwood has a lower rate of avoidable hospitalizations than the citywide rate, actually, which is great. Yeah.
And, so is there anything else in this particular section?
We have fall-related hospitalizations
yeah.
for older adults. Yeah.
Oh, so let's just look at the next one. What was that? Health outcomes?
Yes.
Okay. So here it's a 30% obesity rate.
Right.
1 million. This is what we saw earlier.
Right. Exactly. Yeah.
Okay. Is there anything else in this particular section?
I mean, there are a few other
Oh.
infant mortality, premature death. So we do have causes of death, the premature death.
Yeah, what does that say?
So infant mortality in Washington Heights and Inwood is very similar to the rest of the city, but higher than the rest of Manhattan, right? And then we do have premature death as well. So this will give the basically causes of death. Premature death is death before age 65. And overall premature death is lower in our neighborhood than citywide. But we can see here sort of by what are the causes, then cancer, heart disease, drug use, yeah. So our neighborhood is in blue and the citywide is in the average red.
Wow. So yeah, with drug use, we're above the citywide.
Yes, yeah,
And also with accidents, including drug poisoning, excluding drug poisoning.
right. So it's accidents except excluding overdose. So,
But that would include like automobile accidents or something. No?
Yes, construction accidents.
Yeah, right.
Yeah.
Wow. But in the other categories here, we're below the citywide average.
Right.
That's
Yeah, causes of death are slightly different in different neighborhoods. Yeah. I'd like to show you another.
Okay.
One last feature is
Yes.
the maps tab.
Okay.
So on the far right, and this basically has this information, but sort of flipped so that you can look at the map of the city. And for example, this is another housing related measure, homes reporting cockroaches. So in the housing and vacancy survey, folks are asked if they saw at least one cockroach daily over the last month.
Yeah.
Yes, sorry.
A survey picture.
Right. And so then on this page, we can see the whole city. So you can sort of see from the colors, which ones have the most cockroaches. You can hover over.
Well, we're way up there.
Yeah, and then you can see here which neighborhoods have the highest rates of cockroaches and the ones that have the lowest rates of reporting cockroaches.
What about rats and mice?
We don't have rats in this, but we no, I meant sorry, in this tool, but yeah, the Environment and Health Data Portal does look at rats actually.
Yeah.
Yes.
They're very much presence in our neighborhood.
Same, yeah.
Both close to the best and the worst of housing.
Yes.
Doesn't appear to tie to housing conditions. It often seems to tie to construction.
Yes,
And people throw the birds. Sorry.
Yeah.
Oh no, yes.
Yeah. All right.
Yeah, so I was just gonna pull this up because we do have
When we do our budget, how do we impact?
Oh, here.
These things? I do.
Well, we try.
well, I just wanted to show you this. The Environment and Health Data Portal has some information on rats. I have noticed from here that a few neighborhoods around ours are sort of rat rat mitigation zones. Like
Yeah.
Harlem and Grand
Yes.
Concourse are rat
Yeah.
mitigation
Yeah,
zones.
but-
And I've asked, does that mean they're coming here? Like, is that, is that where they came from? Because I see a lot of rats as well, but,
But we haven't apparently reached that level where.
right, we haven't been identified yet.
Yeah.
So let me ask you, it's interesting, just looking at you, you asked a question about roaches,
Mhm.
but nothing really about mice, not rats, I'm talking about mice. So
There's,
considering I think that would mice be a little bit more problematic for your health as opposed to roach and that.
we pulled out the roaches measure because of the connection to asthma.
Oh,
Yeah. Because it's often a risk factor, in homes for children.
And that lights.
Yeah.
and-
I'm sure mice would be as well, but roaches are just so much more.
I mean,
Yeah. Yeah. Um. Yeah. So that's the community health profiles. I hope you'll look at all the things on the, yes, and please do email me with any questions. Happy
Absolutely,
to help.
yes.
Yeah. Yeah.
And you're saying that it's updated every 2 years?
Yes.
Wow, okay, wish I'd known that. Okay, very good.
Now we know.
Yeah, now
Yeah.
we know.
Yeah. And
And-
we're also working on a sort of redesign because as we've talked with folks, we've realized not everyone feels the same about the categories, right? I mean, just how we put everything in categories. So we're hoping to make it a little easier to use.
Well, that's fantastic.
Yeah.
Well, thank you very much. This is definitely a useful tool which we rely upon, and then now we know that we can rely upon it more often.
Great.
And by the way, you mentioned earlier a former commissioner, Mary Bassett.
Yes.
You know that she was also a resident of Inwood.
Yes, that's why I mentioned her. Yeah. Yeah.
And I think her mother may still be living up there.
Yeah.
Are any questions for Martha?
Thank you.
Is there anything out in the Zoom sphere? I don't see any, well, can we move over to the attendees? Anybody raise their hand? No. All right, very good. All right, well, thank you very much. And appreciate the fact that you came here
Of course. Thank you for having me.
and that you were so patient in waiting for us to begin.
It's a pleasure.
All right,
Thanks.
all right, thank you so much. And feel free to come back whenever you want. Okay, so we're gonna move on to the federal government now. To representatives from the Centers for Disease Control, specifically the National Health and Nutrition Examination Survey. We have Alexa Ortiz, who is the Media Relations Task Lead, and Alicia Frazier, the Advanced Arrangements Operations Director. So I think we may be one of those advanced arrangements. Alexa, you going to begin here?
Yes, I can begin. Can you all hear me okay?
Yeah, it sounds as though you're sort of talking in a tunnel, but we can hear you perfectly well.
Okay, let me adjust my settings. Okay, hopefully that's a little bit better, but let me share my screen here. All right. So thank you all so much for allowing myself to present. My colleague Alicia Frazier was on the call a little bit earlier. Unfortunately, she had to hop off. So it's just me right now. But I appreciate you letting me join for today and present on the National Health and Nutrition Examination Survey, more commonly just called NHANES. So I'm going to go through a couple slides and show a video and kind of go through the details of our upcoming work in the Washington Heights and Inwood area. But first, just a very quick introduction. As I said, my name is Alexa Ortiz. I actually, while NHANES is operated by the Centers for Disease Control and Prevention, I myself, as well as my colleague, work for RTI International. So RTI International is a nonprofit research organization. RTI is the statistical sampling and data collection contractor for the National Health and Nutrition Examination Survey. At RTI, I work in the communications group, and for NHANES specifically, I am the media relations task lead. So alongside working with traditional media outlets to kind of help promote NHANES, I also do a lot of outreach to, as myself and Alicia do a lot of outreach to help raise community awareness about NHANES and provide folks with information about the work that we're doing in the area.
So RTI would be a contractor working for CDC to do the survey?
Correct. Yes. Yeah, we're a federal contractor.
Okay.
So yeah, if you, oh, I'm sorry, go ahead.
No, I'm sorry. Did you say what RTI stands for?
It stands for Research Triangle Institute, but the official name is just RTI. The full name is RTI International. If you go back, you can see the abbreviation for Research Triangle Institute, but on all documents, our name is usually just RTI International.
All right. So does that mean you're located in North Carolina?
Yes, I'm physically located in North Carolina. My colleague is located in Chicago, and there's a whole lot of other folks that are scattered throughout the US that work for RTI.
Oh, very nice. Okay, I'm sorry. Go ahead.
Oh, no worries. I appreciate the questions. So I'm going to stop sharing my screen, show a quick video about NHANES. It provides some helpful overview information, details about what we're collecting, how participants are selected, and some of the work, what actually the participation in NHANES involves. So let me, there we go, hang on. Okay, you all should be able to hear the sound.
The National Health and Nutrition Examination Survey, or NHANES for short, is one of the nation's greatest resources for understanding the health of people living in the United States. For more than 60 years, NHANES has measured the nation's health and nutrition. Now we're coming to your community and can't wait to see you. NHANES is different from other surveys. We collect data from both in-person interviews and physical exams. Having both types of information makes NHANES data more complete and useful. How does NHANES collect data? First, we scientifically choose communities to visit each year that will best represent the United States. Then, we mail letters to randomly selected households in these areas to tell them about NHANES and that we'll stop by to talk to them about being part of the survey. Finally, we visit these households in person to see if people living there are eligible and willing to take part. If so, we'll interview them about their health. This takes about 1 hour. After the interview, NHANES participants schedule appointments for a health exam at our mobile exam center and dietary interviews by telephone. Health exams take place in state-of-the-art mobile exam centers that travel around the country. Our team of highly trained and experienced health professionals perform the physical exams. They measure height, weight, and blood pressure, just like in a routine doctor's exam. They collect urine and blood samples to test for things like heart health, kidney and liver function, and environmental exposures. The exam can include other tests that are not always done at a regular health checkup, like an oral health exam, a vision or hearing test, or a bone density scan. The exam that each participant has depends on their age and sex, but most people spend about 2 hours at our mobile exam center. Participants get some of their exam results that day, while other results will be available later via a private portal. Participants can share exam results with their doctor if they want. NHANES will not share results to anyone other than the participants. NHANES participants receive a generous token of appreciation for their time and effort. Participants can be proud of contributing to a critical national health study, influencing policies and programs that improve health in the United States. How are participants selected to take part in NHANES? Having every person in the United States participate in NHANES is not possible. So instead, NHANES makes sure that all kinds of people are represented in the survey in a way that reflects what the country looks like. We call this creating a nationally representative sample because it allows us to provide health estimates for everyone, not just those who participated in NHANES. About 5,000 people participate each year. Each person selected represents other people in the country. To make this happen, we divide the United States into distinct geographic groups based on how similar they are to each other. Local areas are selected from each group to represent the nation as the first step in NHANES sample selection. Within each area, neighborhoods are randomly selected, and then households within these neighborhoods are randomly picked. Each selected household is mailed information about NHANES. Then an interviewer comes to the home, and an adult household member completes a short survey about all the people living at that address to see if anyone living there is eligible. We may randomly select multiple people from each household to take part in NHANES. Each person selected represents tens of thousands of people like themselves across the United States. If someone is selected and decides not to participate, no one can take their place. Why are NHANES data so important? NHANES data inform decisions about health policies, education, and research for our country. They help create snapshots of the health and eating habits of the U.S. population. NHANES data help us see whether people are getting more or less healthy over time. The data also reveal how common certain diseases are and can identify any new health issues. These snapshots help shape new health policies and programs. NHANES data have been used to track health differences across groups in the nation. For example, NHANES found significant differences in awareness and treatment of high blood pressure across different racial and ethnic groups. Using information from NHANES, health professionals and policymakers can make informed decisions on how to address our nation's health concerns. NHANES data have also been used to create pediatric growth charts to track children's physical development, discover the steady decline in secondhand smoke exposure, help us figure out what chemicals in our food and environment may be harming people's health, show the importance of adding nutrients and vitamins to foods in helping prevent birth defects, and inform recommendations for nutritional labeling. Over the last 60 years, our data helped make changes in public policy and laws. In the late 1970s, after NHANES data revealed an alarming number of Americans had high levels of lead in their blood, Congress passed laws to remove lead from gasoline and paint. Over the next 20 years, NHANES data showed how levels of lead in blood declined. By the early 1990s, the problem was largely under control. How are data from NHANES participants protected? All data we collect are kept private. We are bound by law to protect NHANES data and have been doing this for more than 60 years. Participants must give consent to participate in NHANES, and their personal information is not shared. NHANES data are shared with others only after we remove anything that could identify participants personally, including the part of the country where they live. Combining data from all participants together gives a picture of our country's health while protecting the privacy of NHANES participants. How to help NHANES succeed in your community? We are so excited that your community was selected to be part of NHANES. We need your assistance, support, and participation over the next few months to make NHANES a success. Your help now will create a legacy to help improve the health of the U.S. population for decades to come. It's so important that everyone in your community who is selected participates in NHANES. A wide variety of participants and the support of the whole community are vital to making NHANES data representative and accurate. NHANES has a long history of working with many different communities, and we ask for your help to continue this work. Every year, NHANES is conducted in dozens of communities, interviewing and examining about 5,000 people. We want to hear from you how we can make NHANES a success in your community. We look forward to working with you on this important effort to understand our nation's health one community at a time. By supporting or participating in NHANES, you can help make your community part of something big with meaningful, lasting impact. Together, we can ensure NHANES represents everyone in the United States. To learn more, visit www.cdc.gov/NCHS/NHANES.
Right, let me pull up my slide deck again. Okay. All right, I'm just going to go through a couple details that get into a little bit more specifically about the work that we're doing in the area. But just to recap some high points from the video, as I mentioned earlier, NHANES is run by the National Center for Health Statistics, part of the U.S. Centers for Disease Control and Prevention. And it really is such a good resource for our country because for more than 60 years, it's helped to capture a snapshot of the nation's health that has then helped us better understand the health of everyone living in the United States. And as the video discussed, this is achieved by collecting data from a couple different streams. So we have interviews that happen in folks' homes. We do interviews by telephone, and folks come for a health exam to our mobile exam center. As far as the dates that we're going to be showing up specifically in the Washington Heights and Inwood area, our field interviewers are going to start working to collect data earlier in July. Our mobile exam center is going to be set up in Upper Manhattan, specifically that northeast corner of West 131st Street and 12th Avenue. And it's a undeveloped lot that our mobile exam is going to be set up in. And then obviously the interviews happen over the phone. And we recognize that participation in NHANES takes time, it takes effort. So we do provide folks with a monetary token of appreciation for kind of each step in that data collection process. And then alongside that, we also offer compensation for transportation as well as child or adult care costs. And as the video said, folks also receive their exam results by participating that they can then take to their doctor, discuss that. And then I also like to highlight that our exams typically involve things that folks don't get at routine physicals, or routine visits with their primary care, like bone density scans, eye exams, dental exams. The exams that folks receive are based on their sex and age, but it can definitely include some ones that aren't typically included in a routine physical. And then, of course, we always get the question of like, how is this data used? What's the impact? Why is it important? So I just added a slide here that kind of goes through some of the more recent NHANES data use that was done by the CDC, specifically to look at cardiovascular disease as well as cholesterol in both children and adults. And then alongside how CDC has been using it, NHANES data has also gone on to help inform insights around our consumption of ultra-processed foods, use of tobacco, e-cigarettes, rate of obesity in adolescents, as well as updating of cardiovascular statistics and improvement of our understanding around risks for cardiovascular disease and stroke. And then kind of in conclusion, our specific ask and how you can help us be successful in your community is we really look to local officials and local like community boards, other elected officials to really provide recommendations about, is there anyone else that we should be contacting, sharing information with about NHANES? And we also look to local contacts to help assist our team in promoting NHANES. So sharing information through newsletters, social media, such. We have partner toolkits that we can share with folks to hopefully make that as easy as possible. Because unfortunately, I can't go to the CDC website or the CDC social media and post information about NHANES. We have to look to our local contacts to help us out with that and help spread the word. And then last but not least, we also ask folks to hopefully provide a letter of support. This just helps promote the legitimacy of NHANES because we really want to provide reassurance to residents and those that are randomly selected to participate. We're not trying to sell them anything. NHANES is a trustworthy initiative. It's legitimate and help them understand the importance of what their data is contributing to. So that's all my presentation. I have my contact information there. Alicia's contact information is there as well. And of course, happy to answer any questions that folks might have about the work that we're doing.
Yeah. Well, let me just say that I appreciate the work that you're doing, and I believe that the survey is meant to do collect information independently and to make it useful. Unfortunately, in the current situation that we find ourselves in, there is a lot of skepticism about the CDC and whether or not it's really doing good work, and whether or not the information that's fed into the CDC ends up being used for for legitimate purposes or for how it should be intended to be used. So, there is that question. But, and I don't expect you to respond to that. But let me just say that I'm also very concerned about the location selected for the mobile exam center. Because if what you're looking for is to collect information specifically for Washington Heights and Inwood, 131st Street is West Harlem. It's about a mile south of Washington Heights, and 12th Avenue in particular, 12th Avenue and 131st Street. I mean, that's like
It's basically the old fair.
it's the old fair. It's across the
You know, it
street.
may be part of
It's-
maybe part of the Manhattanville campus of Columbia.
Yeah, that's what it is.
It's useful in
Yeah.
some ways.
Yeah, because the fairway was on the other side of 12th Avenue. It was on the
It's
It would-
for-
yeah, it's 12th Avenue. Yeah, but it's really I wouldn't say it's convenient for Washington Heights and Inwood residents. It's because it's also not that close to the subway.
No, it's not costly.
So I don't know. So how set in stone is that location for you?
Yeah, so to the first point you mentioned about concerns around the CDC and other items, I always like to say that, and NHANES has been around for decades, multiple administrations, has gone through a lot. And I feel, and I always like to say that no matter the administration, no matter what's happening, public health is always going to continue to be a priority, and the importance of our data will continue to be important. And specifically for the location, we completely understand regarding regarding convenience to the folks that could potentially be randomly selected. We did try to find a location that was closer to where we'd be working. Unfortunately, the vehicles are rather large. They have a footprint of about 50 by 80. And unfortunately, finding a space that can accommodate that plus connection to electric is a little bit tricky. So that was the best option that we had as far as something that was available that had electric nearby. And we're hoping that the fact that we offer compensation for folks to get to not only travel compensation, but also a monetary token of appreciation, that will help offset some of the inconvenience of the location.
Well, I don't know. Maybe we should look around a little more.
Steve,
Yeah, go ahead, Richard.
in a comment to that, to some extent, I understand that maybe it needs to be outside the neighborhood, but that's not a transit-friendly location, and that would be my greater concern.
I'm sorry. Say that again.
It's not a transit-friendly location.
Oh no, I said
That
it.
would be
No.
my greater concern
So,
than
Yeah.
just having to go into Harlem.
Yeah.
I have a question. In terms of having the mobile unit, what are the requirements where the unit is going to be parked?
As
Do
far
you
as like the physical requirements,
Yes.
yeah, so it needs to have a space that's 50 by 80, and it needs to have a connection to electric. It can't, once it's set up, it can't be moved. The mobile exam center is mobile in the sense that it goes around the United States, but once we get it set up, it requires a lot of it has like an RV camper, it has like pop outs that come out, and it also has a lot of equipment that has to be calibrated once it's actually stationary, and we need it to be level to ensure the equipment is calibrated correctly.
And for how long is the unit station at that particular location?
Well, it'll be about 2 months. No?
Yeah, it's about 12 weeks. In this case, it's arriving in late June, and I'm like June 30th, July 1st, and it's going to be there through the end of September.
It's 3 months.
That makes DOE sites a little more
Exactly,
difficult.
more difficult, that's.
Yeah.
The schoolyards was the first thought there.
Yeah.
Oh, you say schoolyard are too hard to get access to. I was
Yeah.
thinking maybe near a big bar where they,
Yeah.
they can use the parking spot for that.
I don't know.
Maybe near.
I mean, if we found another location, can you make a change?
If you found another location, we would certainly investigate it. That being said, we've already signed an agreement with Columbia University because they're the ones that oversee the lot for that lot to be used. And because of how much time it takes to prep the electric, to get everything ready for the vehicles to show up, we've already started that process.
Okay, so yeah, so it's on the Manhattanville campus. Okay.
No, I'm guessing with what she just said, it's the old Fairway parking lot.
No, it's not, because
Parking lot.
it's not.
It's-
No, it's
it's-
on the other side of 12th Avenue.
Yeah,
Is
it's across the street from where the old Fairway used to be.
Yeah.
That's
Okay, so let's go back to as part of the national survey. You said you do 500,000. Oh God, you do you interview or you contact 5,000 people across the country. And how many people are you targeting in Washington Heights and Inwood that you wish to interview and examine?
There would be about 600 households that would receive a letter letting them know they've been randomly selected.
But obviously, you're not going to get 600 households to agree and to participate. And in each household, are you just looking for one person to represent the household? Are you?
Sorry,
I mean,
go ahead. The answer is no, it can be multiple folks. Sometimes it will be entire families. Sometimes it's only one or two people. It varies.
but in what? I mean, how many different community? Is this the only community that you're looking at for the survey this year? I mean, you're not looking to do 5,000, reach 5,000 people in this community, are you?
No, it's only about the 600 households that would be contacted. It wouldn't be five. It's 5,000 overall.
Right, naturally. But with 600 households, it's more than 600 people?
I know it's about 600 people
600 people. Okay.
or 600 dwelling units, and then it would.
Okay,
yeah.
But all told, your target is to reach is to have 600 people participate, whether it's one or more people in a household, that doesn't matter. But if they participate, it's in they would go through both the 1 hour interview and the 2 hour exam. Is that correct?
It's because the questions can vary, and because the health exam can vary based on the person's sex and age. It's not a specific. I can't give a specific time as to how long it would take.
Okay.
But they would go through the home interview, telephone survey interviews, as well as be invited to the mobile exam center.
Okay, but you would need them to do both. You would need them to both be interviewed and have the exam at the mobile center.
Correct.
Right?
Yes. Mm-hmm.
In order to fulfill what you need for the survey, you need to. It's not enough to just do the interview. They also need to do the exam and vice versa.
Correct. Optimally, we would like for everyone to do both. Sometimes that doesn't always happen, but optimally.
Yeah, but that's what would make sense.
Mm-hmm.
Okay. All right. So and the okay, I think the people the letters are going out to 600 households, right?
Yeah, about 600.
Okay.
Yes.
Have they already gone out?
They would go out a little bit later this month.
All right. So at this point, nobody knows whether or not they've been chosen.
Correct.
Okay. All right. And are you looking for a particular age and ethnic distribution?
No, we always say that NHANES collects data on folks from birth to death. So because it represents all this data is going to feed a data set that's going to be nationally representative. And we're not looking for a specific demographic in the area.
Okay. And when you collect this information, are you mixing it in with the thousands of others that are part of this annual survey, or will we know specifically what the information is that you gathered from this community? Will you be compiling the Washington Heights Inwood results separately?
That is a very common question we get. Because the data is federally protected, we can't give the data that would be specific to your community. We can't make that available like as a chunk, like, hey, this is the area that we got from the Washington Heights, because it poses too much of a risk of an individual being identified. So all of the data would go to the nationally representative sample, and then that data would be accessible through the CDC website.
Oh, well, that's a shame. I mean, if you're interviewing as many as 600 people, I don't know how we would be able to identify any particular individual. I mean, I was hoping that we would be able to get, as with this previous presentation, I was hoping that we would get information that would be particular to our community that we could, that we could utilize. So that is a bit unfortunate, I think. All right. Any other questions? All right. So I don't know. You're going to be finished with this at the end of September. Um, would you at least be able to come back to us maybe in October, or just maybe send us an email and let us know whether you succeeded, how many people you reached in the community, whether it turned out to be a successful venture into Washington Heights and Inwood?
Yeah, absolutely. I can definitely, it might not be as soon as the month after, but I can definitely, happy to share an update to let you know how it all went.
Yeah, would be curious to know. Um, okay, I think that's it. So people cannot just volunteer if they want to participate, and if they want to get the $100 honorarium, they can't just offer this. They can't just like call you up and say they want to participate. It's not random. Okay, it's got to be
Correct.
completely random. All
Correct.
right.
Yeah, it's census data is used to randomly select households,
Yeah,
and then randomly select the individuals from those households.
but based on the census.
Correct.
Okay. All right. All right. I think. I mean, if I come up with any other questions, I'll send you an email. But I think that covers it.
That sounds good. Yeah. Any other questions, please feel free to reach out. But I really appreciate you letting me come to present tonight's meeting.
All right. All right. Very good. All right. Thank you
All right.
very much.
Thank you. Bye-bye.
All right. Take care. All right. What is it? Pauline, are you're with us, aren't you? Yes.
Hello, I am here.
Very good. Okay, Pauline Ferranti is going to give us her monthly report on all sorts of different diseases and illnesses. Go ahead, Pauline.
Okay, well, let me just try and share my screen 1 second. And it should bring you to the respiratory illness data page. So we're looking down, trends are downward, so that is good in COVID, flu, and RSV. But if you are interested in this information, all of the things I'm sharing with you tonight are on our website and readily available, although I know our website is sometimes difficult to navigate. So if you do need help with that, please just let me know. I know, is OC here tonight? I didn't hear her voice.
No.
But I know
OC is not with us.
she's very interested in the rabies. So good
Yes.
thing is that although we are seeing quite a few of our raccoon friends and some skunk friends in Staten Island and the other boroughs, thankfully Manhattan and Bronx are looking pretty good so far. So that's good news. This was updated on the 21st of May.
So no cases whatsoever in 2026.
Correct. So far, knock on wood. And then I also know that measles is a concern for the community board as well. So as of May 29th, there have been 6 confirmed cases. So I don't believe that is a change from the last time I presented. But this is always,
There's six confirmed cases citywide.
that's correct. Yes.
Right. As far as you know, are any of those in Upper Manhattan and Washington Heights Inwood?
No, not to my knowledge.
Okay.
And then I know that people are always interested in tick and tick-borne illnesses. So we do have a summary. I don't know if I shared this with you last time as well, but we have a surveillance summary. Of course, it's a few years old, but this is just some information that we gathered over the years. And it's just really helpful for people to know sort of what ticks look like, look at how small they are. So it's extremely important that as you are engaging in outdoor activities this summer to, really either use bug spray or wear long, loose clothing and check for ticks on yourself, on your kids, on your pets, just to make sure that everything is okay. And then I just wanted to highlight that the commissioner did give an update on the first about the two New Yorkers who were undergoing the hantavirus monitoring. So they were on that cruise ship and were exposed, but they were not exhibiting any symptoms. However, they had to go directly to, I believe, Nebraska for some monitoring and quarantining. So one was a New York City resident. However, they had a another home upstate, and so they have chosen to return upstate for any additional monitoring or quarantining as needed. So they are not returning, that individual is not returning to New York City. So at this point, risks to New Yorkers remain low. And again, just wanted to highlight that with all the activities upcoming this summer, like the World Cup, 4th of July, the 250th anniversary of America, Fleet Week being, larger than usual, we are monitoring and we are trying to make sure that, if we are seeing any trends to alert the community as quickly as possible. But I know that in general, points of entry are being very careful. And I believe that, there are some denial of visas for countries that are seeing some, large scale illnesses like Ebola, for example. So we are doing our best to monitor all of that to keep New Yorkers safe this summer. And then I just also wanted to highlight that we do, in addition to the community health profiles, we have a lot of information on our data tab. So I know, childhood vaccination data is very important for the community board. Again, the health profiles you just learned about with Martha, but we have a whole bunch of other sort of data sets that are available. And I believe a lot of them you can search by zip code. So I would encourage everyone to just play around with our website just to see, if you can find any interesting health information that I don't cover. And then if you would like me to, provide updated information, if you find something that you're interested in, but some of the data is out of date, you can always reach out to me and ask if we are planning to do any updated information on your topics of interest. But this is our just main page, and we're just focused now on a campaign to stay safe and cool this summer. So those are all my updates. I'm happy to take any questions. Thank you.
Yeah, was there a recent surge in the rotavirus? Wasn't there an issue a few weeks back about that, or a few months back?
No.
About rotavirus in New York City?
Yes.
Don't, I mean, not to my knowledge.
Okay.
I will look into that though.
Okay. And you started out, I guess, by saying that in terms of flu, the trends are going downward.
Yes, yes, all of the respiratory illnesses are going down. Hold on, let me just, you can see all of my searches, by the way. So forgive me as you look through my history.
Oh God. I really I don't know I don't want to know all those things you're doing.
No, you don't, you really don't. It's quite embarrassing. No, I'm just kidding. Let's see. So if you go to our COVID-19 tab,
Right.
if you hit the data tab, you will see all of our respiratory illness data information. And so it'll bring you right towards here. And then you can see this is just a general overview, but if you want specific information, you can always click on it, or you can, sorry, my phone. You can click on the data and then it'll go, it's differentiated by emergency data information, department information, and lab reported cases, so confirmed cases. So all of that you can, click on flu or RSV And so it
Okay.
has that information for you readily
Okay.
available.
Could you just go back to that chart that showed flu, COVID, and RSV next to each other?
Sure.
This one, yeah, right here. Oh, don't go away. Keep it there.
Okay, I will leave it right there.
So COVID is decreased from these are hospitalizations. Is that correct?
Yes.
These are the percentages of people who are, oh no, these are emergency department visits. So this is
Yes.
this is a percentage of the overall number of ED
ED
visits
visits.
in the city of New York. So with
Right.
COVID, it went down from 0.13 to 0.09,
Correct.
and flu went down from 0.26 to 0.14, and RSV a 0.02 to a 0.01, and it's all right. So again, I have a problem with this particular data set because the number of ED visits can vary from week to week. So you don't really, well, the percentages are somewhat meaningful, but you don't really know the actual the numbers per se. Yeah, But okay. Rita has a
I
question.
have a question about Ebola. So people who've been traveling to Africa to various countries and are returning to New York City, do they have to be quarantined? And if so, which countries? What are we doing about Ebola?
I can find out about Ebola specifically, but I do know that, of course, if you're a US citizen or you have a green card or permanent resident, you are allowed to return. So there is no restrictions on your returning to America. But I believe I read something about everyone having to go through Dulles for very specific screening. So let me just confirm that, and then I will send Steve an email to share with membership.
Thank you.
Sure.
So you think it's possible that anyone there are, I think, two particular countries in Africa where this is a problem. So what you're saying is that what is that anybody coming back to the States from those two countries might have to take a flight to Dulles Airport in order to be screened.
Yes, I believe I read that, but I will have to double check to make
Okay.
sure,
All
and
right.
then I will confirm with you.
Okay, very good. Any other questions? No? Darling, no? All right, very good.
Thank you.
All right.
Thank you.
Okay, thank you very much. All right, next, Julio.
Oh, hey. First, let me just say that, Rich and I were at the, Medical Center Neighborhood Fund Award Ceremony.
Oh, shoot, yeah.
Nice attendance. Diego was there and he mentioned that he mentioned he would not be able to come and make,
Right.
Columbia's presentation, so. Just wanted to relate that. Just a couple of things. Last month, you asked about the Broadway project, which is 169th Street in West 70th and Broadway.
Yes.
That project initially was a hospital project where we intended to build storefronts at the bottom, early childhood hub on the second floor, and then split between housing for staff, medical staff, and the other half was what we called guest accommodations,
Right,
similar to a hotel. We can't call it a hotel.
right.
COVID happened. That unfortunately, that project was scrapped. The idea was for the last year or so was that the property was going to turn. We were going to demolish, and we did.
Yeah.
The property would be turned over to the university for them to develop medical student housing, with the ground level still being commercial, which the hospital will administer. The residential portion of the housing would have been administered by the university. That at this point is also on hold. So the university and the hospital are still sort of discussing what's feasible for that particular property. So more to come on that.
All right, because at one point in one of our other meetings, Joe Iannuso had said that when I asked him about this some months and months ago, last year, in fact, he said a decision, he expected a decision to be made by the end of last year.
But, and
But-
the decision I think was the house,
What?
the decision I thought was the housing.
No, the decision was whether or not it was going to be developed by
Yeah.
Columbia or by the hospital.
Yeah.
Yeah, so it's still up in the air.
The address again is 159 what?
It's Broadway 169th and 170. It's the.
Yeah.
Oh,
it's the lot that's-
Where the Christie's used to be. Yeah, Richard.
I just want to add one idea that I don't hear talked about much in the neighborhood, and maybe it could fit this property. Around the armory, the buses that unload there, wait there, and really more on the Fort Washington side than anything else. They create a considerable burden. If they were a way to build into the space some kind of unloading building area, which might not take up that much. It might also make us, maybe there's a possibility for unloading armory buses on the 169th side instead of Fort Washington. You know, I'm not an architect and an engineer
Yeah, I-
there, but I just like to have this part of the discussion.
I'll let them know that this was brought up, so there's a,
Thanks.
that's an congestion on Washington. You know.
So you just have parking spaces for the buses that bring the kids to the armory?
It's unloading, I think.
Oh.
Well, there are two different things here. Maybe both could be done, maybe one. Unloading is one of them, parking is the other. One out of two would be an improvement.
Yeah, I'm not sure you could fit buses, where the idea for parking was they will be parking underneath the building. But these are for vehicles, I mean, buses is,
Yeah,
I put this in the discussion even on that, whether that's
Okay.
appropriate use of some of the parking space.
Are you referring to the Columbia buses or the
Oh.
buses that bring the kid to the armory?
We focused on armory events.
yeah,
That's the thing.
yeah,
The short-term nuisance
yeah,
blocks Fort Washington continually,
well, you,
make the bus stop inaccessible, just lots of small nuisances.
well, you're talking about when they bring the kids to the track meets.
Track meets.
Yeah. Okay,
I mean,
so the other thing that, the committee brought up and, you asked Diego, was on the Department of Health building at.
Yes.
68th Street.
yes,
The hospital had been in discussions with the Adams administration, for that building to be, turned over. Most of it is right now is university, programming there. So there were discussions with the Adams administration for the hospital to, take possession of the property. That nothing was ever signed. Those discussions, continue with the new administration, to see whether in fact, something could be inked out and signed where that, building or the property. I wouldn't say revert back, because the land itself it's property of the hospital.
so it's not Columbia, but the hospital.
It's a hospital.
Oh, really? Oh,
So I know that, as these discussions take place, Seniors Helping Seniors is a tenant there. They were somewhat concerned, by the rumors what's going on. We went and visited them last week. We assured them that first of all, nothing has been signed. Second is even if something is signed, it's gonna take years for anything to really, because that building needs serious renovation anyway. By the time that comes around, even if something is, the property is turned over, it's gonna take years for that to happen. So they should be, sure that, nothing's gonna disrupt their services for the next few years. And if that happens, there is a commitment, we made a commitment to Seniors Helping Seniors that we'll find them a comparable space while the, renovation thing is being done, and then they'll go back to the
Yeah.
location.
but meanwhile, the city has plans to do a facade work on the building and maybe also roof work or something.
Yeah, I think at the end of the day, if the city turns it over, I assume the hospital will take on that responsibility. I mean, I'm not gonna,
Huh.
I don't think the city's gonna give you site control and then still do the work.
Yeah. Pauline, do you remember this question? We'd asked you to look into it more than once about whether or not that facade work was going to happen at the Health Department building at 600 West 168th Street.
Yeah, it was like a DDC project also, right?
Yeah, exactly. Yeah.
Yeah,
it-
I haven't had any updates on that. So and then also I believe now that the building is no longer right, I have to refresh my memory on this one, but I will circle back with our facilities team.
Okay. Well, Julio was saying that the building is still in DOH's possession. That
Okay.
although there have been discussions between the city and the hospital about the hospital taking over the building, they've never been concluded. So, but apparently, it's still a possibility that the hospital is going to take over that building. So, I'm
Right.
wondering whether or not the DDC project has been put way on the back burner, or whether it's still active at all.
Or part of negotiations for the new ownership to then take over the project. I don't know. I will have to let me follow up with our facilities team.
Yeah, please look at it from your end.
Will do.
I'll follow as well.
Okay, very good.
Now, just to let you know, as part of the visit to Senior Summit Seniors, I guess if folks are not familiar with Senior Summit Seniors, you may want to go down there and see them because they do a lot of great work. And so we were there were a lot of seniors who were waiting for services. And of course, one of the things that they asked for was that their technology is not updated. They have computers that were donated to them years and years ago. We gave them printer 2 years ago. It's outdated. They wanted to get support with something that the hospital may use. We decided that we were not going to give them anything that's we're using that's used. So we decided to give them a technology grant for them to go out there and get on the computer
How much?
and 1,500 for the computer. And
Right.
Is that enough?
1,500 for how many computers?
no, just there's only one staff.
For
And
the.
they're still using the others, but it's not as.
No new printer?
Yeah, we're gonna give yeah. I mean, but they do fabulous work, so
Excellent.
so we're happy.
What do they do? Just give a couple examples.
So Seniors Up and Seniors is, they do, on behalf of other seniors, they do entitlements, they do their, IT 214, which is the residential tax. They do, their scree applications to freeze their rents, they do their food stamps, they do, so anything, again, they even, work with them to do the retirement paperwork. So they do a lot of great work.
Is this, I'm surprised I don't know about it, but is this based in an organization? What is Senior Summit Seniors?
So,
It's a separate organization.
It's separate. And I tend to think that, Steve Kirby, I thought that organization was started by Albert and Dorothy Rose Blumberg? I thought that they had.
They may have played an active
So
role in it.
it's really
Yeah.
bringing the seniors who are around, who are capable to help other seniors.
Like retired lawyers and accountants. Nice.
So, but
They should.
there is a larger group called Senior Summit Seniors. If you could look it up, but it's not that. They're based out of Pennsylvania or something like that. It's a separate. I also wanted to let this committee know that the hospital has been in touch with Department of Health to I would not say close. My interpretation would be relocate, but it's to relocate or close the 994 Washington Dental Clinic. As you know, it's a small practice. The administrator that was there, unfortunately, took sick, passed away. Numbers have gone down. So they have two dentists, one assistant. The idea is that those dentists will move over to Columbia's Dental Clinic, which is on 622 West 168th Street. So they'll be able to relocate there with their other colleagues, which have more services already, so and more support. So the idea is that they will go from there. And of course, as you know, the hospital does not have, that's Columbia. The hospital does not have a dental clinic, a dental department, so it's really,
How are they gonna get there? There's no transportation
to,
to the new location.
well, no, they're going from 994 Washington, 164th
Oh,
Street
well,
to 100 CA Street,
gotcha.
Vanderbilt.
And maybe not completely irrelevant, but Columbia Dental School has a good mobile van.
They do too. They do too. I mean, so as part of the process, there will be a community meeting taking place around this. It's required by Department of Health. So once that happens, we'll come back to the committee. Maybe do it jointly if need be, where we will have more further discussion on the closure and any questions will be answered.
Will the information about the meeting be shared in advance
Oh,
or
yeah.
people, where is that going to be?
Well, we'll work with the committee, we'll work with Steve, and one of them together with the health committee as a community meeting, invite people to come and then share their thoughts.
Marcus, this came up at the Community Leadership Council meeting this morning.
But
This question about
Oh.
closing of the dental clinic at 99 Fort Wash. And, but there was no reference to there being a community meeting.
well, they has to be a community.
Really?
Yeah,
Okay.
they has to be.
Well, they did refer to the fact that they have to submit an application to the State Department of Health to get the approval to close the facility. But,
Yeah, they're required to get certificated as well.
yeah.
So that will happen. Finally, also just wanna add that,
And then before you go off, and what we also asked at that meeting is, what are you then going to do with the space? And what we were told this morning was that they would, they're looking to provide some other service for the public. That it wouldn't just be used like for back office operations or something.
yeah, and as you know, that location may be familiar to some of you, I know to you, Steve, is
Yeah.
because we used to have the geriatric practice.
Right,
At
exactly.
that location.
Right.
And that was sort of folded into the AIM practice at
Right.
the ACN, so. But that's the same location, but the dental services remained at that location. The community navigation program will be hosting again a pediatric asthma workshop. We do this periodically. The next one will be Tuesday, June 16th. I will share a flyer with Steve and the board, maybe the board could circulate that around. And hopefully get people to join in. It's a virtual presentation.
June 16th.
June 16th.
Okay.
And then finally, I'd just like to, I know that Diane Ashley is not on tonight, but just like to give her a shout out because Waikoa, Washington State Council on Aging, held their annual conference, and Isabella provided them space at their big lunch space to host a meeting, which I think is really like one of the first larger events that they probably had.
Absolutely.
Isabella
Yes.
spoke.
Absolutely.
So
Yeah.
it was, it was good for them to be able to do that. So. And that's all I have.
And are you seeing in the hospital the same downward trends on COVID and flu?
No, I asked for the numbers. I don't think we can say the numbers, but I assume that the trends are the same. They were going down last time we looked at it, so.
And what about Rita? Don't you want to ask about the adult inpatient rehab unit?
No, I know that it's been downsized already.
Is it
To three,
ha-
to
ha-
6 units.
five
6 beds.
beds?
But it's on the same floor and it's close to the PT gym, but everything else is gone.
So that work has already taken place.
Yeah.
So and do we now have beds there that are being used for people in the ER? Or are there new beds there that are now in service?
That's a good question. So I'll find out whether
That's what they wanted.
those
Right.
acute patient beds are open.
I think that it is. I heard that it is, but don't confirm it.
Did you
Yeah, I
ask the
actually-
question This morning?
I meant to ask that question this morning,
Oh,
but I didn't ask it.
Okay. I'll find out and email you hopefully tomorrow.
All right, thank you.
And the extra psych beds are all there now?
No, the psych unit at Milstein is under renovation.
Oh, I see.
And when is that due to be completed?
So once the island beds opened up, the beds at, mostly closed. That's currently being renovated now.
I see.
At the fourth quarter of this year, they should reopen. With an again, I think it's 4 beds, I think, Steve, right?
Oh, God, I keep forgetting. It's either 3 or 4.
So there will be an increase of 3 or 4 beds
Yeah.
once it opens. The idea is that before it opens, we wanna have this committee come and see it. Before the space opens.
Yeah, but the proviso might be that they're not going to allow us to leave.
Well, I think that most of the committee can leave.
Yeah, almost. Okay.
So, one or two maybe can't.
Okay. Rabies spaces. Oh, shoot. I missed, there were some questions in the Q&A that I didn't look at earlier. And is OC still with us? There was a question from Jennifer Melman about, which I guess was meant for the N. Haynes lady, the only presentation, you know. Okay, I'll have to get an answer for you on that one. And OC was asking whether or not, Pauline, did you already answer OC's questions about rabies baits?
Yes, I did.
Oh, good. Oh, thank you. Okay, good. Oh, yeah. Okay, very good. Next on the agenda is the Columbia University Irving Medical Center report. As you mentioned, Diego Quintuna is not with us today. He did forward his once again a very detailed report to us, which I forwarded to all the committee members earlier today. And once again, I want to draw your attention to the fact that he includes here that the medical center is seeking a community member to serve on one of the institutional review boards, which ensures that research involving human participants is conducted ethically and safeguards participants' rights and welfare are safeguarded. We are looking for a non-scientific, unaffiliated individual, not affiliated with Columbia University, and who can represent the community's perspective. No prior experience is required. Selected individuals may observe meetings prior to committing and will receive onboarding, training, and ongoing support. I gotta, I guess, also make this announcement at the community board meeting. But if any member of the committee is interested, please contact Sandra Harris, the Vice President of Community Affairs and Partnership Engagement. He also forwarded to us some flyers for upcoming events. There's I guess this is a workshop, Heat Health, Get Summer Ready, to be held on June the 9th at the Columbia Community Partnership for Health at 390 Fort Washington Avenue, which is, what's that?
What is on June 9th?
Yeah, I'll give you the flyer. I also emailed it to you. There's something called STEM Quest 2026, which is being held, Discover Your Future in STEM and Healthcare. It's being held at the Vagelos College of Physicians and Surgeons on Saturday, June 20th. Yeah, it looks like it's for, well, yeah, it looks like it's for teenagers.
Did you send that to us also?
Yes, I did. And it's for students in grades 5 to undergraduate. So it's even kids who are preteens. And then there's a maternal mental health workshop being held at the, it's not really clear. This is something called the Family Enrichment Center, which is a city-run program at the George Washington Bridge Bus Terminal on Wednesday, June the 10th, which apparently Columbia is also participating in.
Steve,
Yeah.
before doing announcements, I think we still have one outstanding agenda.
Yeah, well, this is not an announcement. This is the Columbia University report. Okay, so
Okay, that's fair.
so yeah, actually, I can see how you would confuse it with announcements, because it certainly appears to be an announcement, but it's done under the rubric of the Columbia University Medical Center report. So
Well, let's see, what could I confuse you with?
I don't know, there are plenty of things, but next on the agenda,
Mark it elsewhere.
and next on the agenda, we got a guy named Richard Allman, who is giving us a report on
Which is fine.
but-
I do agree with this report.
so this is a report on behalf of the Committee on the Aging, on the ageism issues.
I am gonna be very, very brief, given that I'm also a committee member, would like to go home soon, like shorter meeting. In any case, it's a good meeting. I didn't want to be misinterpreted there. And I didn't bring a PowerPoint, didn't bring a lot of data. It's basically meant to be making sure a conversation is happening between two committees when there is an issue that really touches us both. The Committee on Aging, for the last 3 months or so, has been talking about the issue of ageism, how it affects what it is, how it affects older adults, how it's just as much, it isn't an issue around older adults' behavior. It's an issue around how older adults are perceived, treated, what opportunities. In that way, I guess the best way, I think I'm in a room where there's no doubt about that, but I'll give the little bit of speech I have here anyway. Racism is not about how Black people behave. Sexism is not about how women behave. And as we begin to confront what I think is one of the last acceptable biases in this country, although we're sure starting to re-accept a lot of biases we've dealt with for a while, ageism fits into that same space. As the Committee on Aging has discussed this, we're trying to have at least some kind of conversation with the other committees of the board, with the thought of developing a community campaign, an educational campaign, a campaign that really belongs to all of CB12. Interesting. The event that Julio just mentioned. I'm coming from an event with some very thoughtful, well-educated, well-engaged medical center professionals. And as I raised the issue of aging, just to see how people would respond, and because we really really would like to work on a campaign on this. The responses I got, one of the people, quite a few of them would respond by saying, well, this is what older people should do. One somehow turned it into a discussion of cannabis, which I guess was on that person's mind at that moment, jumped the issue. But what I'm doing a little bit with a smile here is just trying to make sure we're in a position to take this issue seriously, figure out how to do community education, some other community organizations we should be talking to. And I've actually talked to one of your colleagues on social action. But it impacts older adults, physical and mental health, capacity to both restricting opportunities and the capacity to do whatever people would like to do with their lives. In shortening this presentation, I want to just read a couple of quotes that have come to my attention that I think capture this quite well. This one, ageism and racism adversely affect health in multiple ways beyond social and socioeconomic factors. Internalizing ageist or racist beliefs impairs our immune system and reduces self-efficacy. In addition, many health conditions attributed to aging, such as memory loss, hearing decline, and cardiovascular disease, are actually influenced more strongly by negative ageist stereotypes than by family history, genetics, or chronological age. Fortunately, we can do work to dismantle ageist and racist beliefs to profoundly benefit our mental and physical health. Beliefs, expectations, and stereotypes influence epigenetic mechanisms, neural activity and immune function, and how we can change our thinking to grow bolder rather than older. Well, that's a good cliche, but
Where is that from?
I actually have to find where I took that from, because I took it, wrote it down, and then I didn't.
Because I'd like to put that in the minutes.
I will give you this piece of paper, but it doesn't have the quote with it.
Yeah, we gotta be able to attribute it.
Well, the meeting is being recorded, so.
Yeah, I know, but you know, I can't just take it.
Steve's asking the right question.
I can't just take somebody else's thing and I gotta say whose it is.
Over the last couple of years, the City Department of Aging has made an effort to develop a campaign around ageism. We saw some bus stop posters, etc. The campaign didn't have the grassroots base, didn't last. I've tried to get some information where the department's interests are on that right now. I have a hunch that we're not going to hear a lot for about 6 months while a new commissioner does some work that probably really needs to be done in organizing, reorganizing, focusing the committee.
I don't know.
I think if we started to
I'm
develop the Upper Manhattan base on this, some of the educational materials, connect well with the medical center and some of the institutions in our community, maybe get into a few schools so they'd start talking to other schools, or community board leaders talking to the borough board, any of a number of possibilities. And the campaign isn't laid out at this point, but this is the start of it. And this conversation is the effort to make it a CB12 conversation, not just a one committee conversation. Want to do announcements?
not yet. No, we have a heavy issue coming up next.
Questions, of course.
Yeah. So I get, so is the Committee on Aging is formulating some kind of a campaign that you'll propose to the rest of the board?
I think, we're not meeting in June, so this now becomes because there's a fair, this now becomes a September thing. We set up the assignments for May and June for different members of the Committee on Aging to go to different committees around the board. I go again to licensing next week, and while the connections aren't as obvious as the health and environment connections, it's worth talking to all board members. I assume Mary and Irwin, or Mary, Irwin, and I will find a way to bring it to the executive committee. I think that's the normal thing that needs to be done. Get the resolutions passed by the board as quick after Labor Day as we can. Then, of course, we have to find the energy, which means that a discussion with Kiana as our district manager is an important part of that. My own experience is that volunteer energy carries us a long way, but when you're doing something campaign-like, it needs someone who stays on the coordination of it. But I think we haven't addressed that yet.
All right, well, we'll stay tuned to hear more. But I think one thing we should probably do is take a look at this community health profile that we were discussing earlier in the meeting. We may find some useful data in that community health profile with respect to the conditions facing seniors in our community. There's probably information there or elsewhere within the health department website that we can utilize in this particular effort.
The health department's community health profile.
Yeah, did you get one of these handouts?
No, I came late. I'm a troublemaker.
And give them one of these too. Here, okay. You have that? Okay.
Well, no, I think. Thank you.
Oh, this is just a one pager.
I accept anything.
Okay.
There's no promise to do it within 24.
Okay, well, okay, next. Okay, so the resolution on the regulation of noise in public plazas. We made an effort to bring it to the general board last month, and there was some confusion about whether the resolution posted on the community board's website was the one being voted on, and frankly, I think they had posted an earlier version of the resolution, which was very, very similar to the one that I was proposing. And in fact, the major change I made was a change that the Public Safety Committee had requested, to remove, oh shoot, to remove references to the NYPD as being the enforcement agency. And I mean, for me, this was like in the category of no good deed goes unpunished. I changed the resolution to eliminate that wording. It's not the exact resolution posted on the website, but how many times have we dealt with resolutions at general board meetings where you don't have every single word in place, and people take it on good faith that you're going to make a change in the resolution before it gets sent out. But in this particular case, they chose to table the resolution. So with some more very minor changes, this is I distributed the current version of this resolution, and again I've made sure that we're not coming down very hard on enforcement. We're trying to get cooperation. I also indicate here that the plaza managers themselves share the responsibility for making sure that the policies and the practices that we're urging, that they should be that we're calling upon them to implement those policies, not just city agencies, that they're the ones who in fact should have the primary responsibility. I do now spell out exactly all 6 of the plazas, so there's no mistake that that what we're discussing would affect all 6 of them, not just 1 or 2. There was a comment about the fact that we said that there shouldn't be back-to-back permitted events with amplified sound on weekends. Kathy Diaz said, well, there could be like one large one day and a small one the next day. So I said, okay, we'll clarify it. We're just talking about 2 large back-to-back events. If you have a small one that maybe isn't particularly disruptive, the following day people in that community could probably live with it. There's been some criticism that we were limiting the amount of amplified sound to 4 consecutive hours. I took out the word consecutive. If people want to have amplified sound for a couple of hours, do something else, and then come back for another couple of hours, that would be acceptable. We had previously said that you could have weekend events running until 9 o'clock. I took that out because we were told by the plaza manager at Quisqueya Plaza that his intent is to shut down all events at 8 p.m. So in that case, they don't need another hour. They're already shutting them down at 8 o'clock. So those are, I think, basically the changes. Now, I did get a couple of emails from again from Kathy Diaz and from Leo Jimenez. All right, so again, Kathy is saying we should strike out the provision that limits permitted amplified sound to a maximum of 4 consecutive hours. My response to that was to remove the word consecutive. She's saying in practice, this provision is simply unenforceable. The NYPD has stated this before. NYPD can enforce event start and end times, but they cannot reasonably track whether someone first used a microphone at 11 a.m. versus 7 p.m. Any recommendation our body advances should be one that agencies can actually implement. A clear end time restriction is both enforceable and directly addresses the actual concern. The 4-hour limit also places an undue burden on nonprofit and community programming. Word Up, for example, hosted a day-long children's literature fair, an event that would be made impossible under this provision. I don't believe that that's the case. Again, we're just addressing amplified sound here. We're not saying that the whole event has to end within 4 hours. She's saying, again, permitted plaza events should be encouraged. They generate revenue for the city. I don't Maybe they do. I don't know about that.
They do, restaurants
well,
get packed when there are
uh,
events.
Well, they generate revenue for, well, I don't know. They bring life to public spaces and reduce the likelihood of unpermitted ad hoc of activity by keeping plazas actively and intentionally used. Additional restrictions can deter the very groups we want to see using these spaces. I also want to name directly that this provision has fueled a deeply inequitable discourse about who deserves access to public space and for how long. The framing of what is worthy of a 6-hour event. I mean, that's not language we have anywhere in this resolution. We're not saying that some people can have 6-hour events and others can have 4-hour events. Again, we're only addressing amplified sound and trying to minimize the disruption that it creates with people who live right next to the events in the surrounding community. Whether that's a children's festival, a bachata group, or a philharmonic, should not be a question our body entertains. We're not entertaining that question. A time of day restriction applied consistently to all large events is the more equitable and enforceable approach. And in fact, that's what we're doing. We're saying that they should, that 8 p.m. should be the stopping date. So she's recommending.
Well,
she-
we're doing
what-
both.
Well, let me.
Because yes, there is one bullet that talks about the 8 p.m., but then the ones prior to that insists on the 4-hour event. And
Right, well, but not that the event would be 4 hours, but that the total amount.
4 hours per day.
For amplified sound. I mean, the event can run 6 hours, it can run 8 hours. The question is how much, the extent to which they use amplified sound.
But I think that is the piece that makes it very difficult to enforce.
Well,
Because
that's why.
you have someone there clocking in when the amplified sound started.
Right.
It opened the room for
Well-
discussion and discourse that is not needed.
Well, I think, to a great extent, a lot of our rules and a lot of our laws depend upon the good faith of the people who are doing these events. So we're setting ground rules which we would like them to conform with. And in this case now, we're placing responsibility on the plaza managers. They are there. They are on the site. They're the ones who should be able to track how much time people are spending using amplified sound. So we're not saying only city agencies are going to do that, because I agree, city agencies are not going to be there for the whole extent of the event. But we do expect that plaza managers, that should be their responsibility. They should be able to determine how much time is being how much amplified sound is being utilized at any particular event. That should be part of their job. One of their jobs should be not just to allow the event to take place, but to also make sure the event does not unnecessarily impact the people who live there.
Well, I think if they were doing their job to begin with, we will not be.
Well, that's why we need a resolution that reaffirms the fact that we expect them to do it, because nobody has actually done that. We've never passed a resolution. We've never sent the word to them that we expect them to do this.
So why are we not permitting the event on Saturday or Sunday when that is the weekend and that's when people have the more time to go out and have a good time and all of that? Like, I don't understand if we say on Sunday no later than, I don't know, 9 p.m.
Well, again, it didn't seem as though it's necessary to say 9 p.m. when the plaza manager at Quisqueya says his events are to be shut down at 8 o'clock.
Is that the same rule? Because you listed all the plazas. Is that
Right.
the same rule for the rest of the plazas?
Well, the major problem, frankly, is with Quisqueya. We haven't heard from anybody else that there were questions in the past about the one at 175th Street, Plaza de las Americas. Well, but I've been told that that has settled down to some extent with now that Cloth is the plaza manager.
I just think that since you are listing all the plazas here, it's helpful that whatever the mandate or the requirement, the resolution is putting forward applies to each plaza. Because otherwise, the inconsistency of it open the room for lack of enforcement and lack of understanding and, confusion.
No, I agree. I mean, somebody came to me after the board meeting and said that we should change the resolution so it only deals with Quisqueya Plaza. And I say that's wrong. That's we should not be singling out any particular plaza. If we adopt a policy, it should apply to all 6 of them. It's that would be the wrong approach. And I don't know, that guy may not want to vote for the resolution now, but I think that's it's inappropriate for us to only apply the rules to one particular plaza.
Exactly. Which then go back to the 8 p.m.
But I haven't heard of any late night issues at any of the other plazas. And if Quisqueya can live with the 8 o'clock, if that's their own policy, then it doesn't seem necessary to extend it any later. I mean,
Because when it comes to the amplified sound, for instance, and the 4-hour piece and amplified sound, I think that maybe, and I could be completely wrong, the amplified sound we are referring to is music. I don't know, but it also can be.
It could be speaking.
Okay,
Yeah.
be speaking, but then, and to Kathy's point, if you have a nonprofit that is doing a day-long activity and it has many stages to it, that doesn't work for them, the 4-hour event.
Well, I mean,
Because they will be using the amplified system, whether it's to make announcements, to get prices, to whatever it is, for way more than the 4 hours.
I don't know. I mean, for 4 hours to me is a lot of time. A 4-hour event is pretty long for me. And in fact, and I'm using my experience in dealing with parks. When the Parks Department issues permits for events in parks, for concerts, for any event with amplified sound, we limit it to only 4 hours. And in most of our parks, we're not like plazas where they're right next to residential buildings. Most of our activities are not, don't impact residences the way that plazas do. So in parks, people can live with 4 hours, and I don't know why they can't do it in a plaza as well.
I think you just answer that question because it's a plaza, because it's surrounded by community, because sometimes those events are for the community and they are all-day events.
Yeah, well, they could be all-day events, but they don't necessarily have to have amplified sound all day long. I mean, can you imagine living in that apartment and having this concert right outside your window going on for all day long? I mean,
there is a difference between having a concert all day long, which I doubt it will happen, or having a community event that, let's say, start at 10 a.m., whatever, with little sing and extends until the afternoon, 6 o'clock, 8 o'clock. That right there is ending before 8 p.m., but still is going beyond the 4 hours. And during that time, there will be raffle, there will be someone singing, there may be something, there will be a moment of silence. So then are we tracking minutes or so it becomes, I think those are the pieces for us to think about when we decide how we want to do this. So that's why, to me, the start and 8 and end time makes more sense than the 4 hours as a bulk of activity.
Well, let me see if Nancy Preston, who lives right there, whether she might have anything to add to this discussion.
All right. Yes. Okay, can you hear me now?
Yes, we can, yes.
Yeah. Yeah, and this does bring up a point, but it's the amount of amplification. And amplification can be speaking, can be cheering, can be music, can be many things. Um, to make um, perhaps some sort of regulation or recommendation of the type of amplification, the sound, the decibel level, keeping it lower. Recently the New York City Noise Code says 85, right, decibels. But Quiet Communities, which is a national and globally affiliated research and advocacy group about sound and its dangers, have been documenting that at 65, it starts to create at 65 decibels of an hour of exposure creates permanent hearing damage to the hairs in the ear. Now think about that. And the people that are most susceptible to this permanent damage are children, right? So when you're talking about like events that are with children and you have a lot of loud amplification. There have also been some events at the plaza that were speaking, right? That wasn't music, that were speaking, and it starts at 10 o'clock in the morning on a Saturday morning. This is really difficult for people to deal with that. So, I understand the point, and I think also a lot of this has to do with people being the people operating and presenting the events, of being responsible and respectful of the community, because as Steve has said, many of these plazas are right there in residential areas, right? And we have old buildings, so we don't have soundproof buildings.
But Nancy, thank you so much for that. And I think that reinforce in a way, the example of the 10 a.m. And if when you are in a quiet community, something that at 10 a.m. with either whether it's cheering for someone or just speaking, that could be disruptive. That's what I'm more inclined for the committee to really, along with the community, to set up a time frame that makes sense. Whether that time frame is no earlier than 12 p.m. and no after, 8 p.m., whatever that time frame is, but that really the community, there is clarity in being able to enforce the regulation. Because otherwise, I think it becomes really tricky, because someone can say, well, we are quiet now, we just did 20 minutes noise between whatever and whatever, and then when does it stop? So it's really difficult to try to track the number of hours of sound. But if we can say from this time to this time, then we have a better shot at it. And then it becomes a very standardized schedule across all the plaza.
You could post it.
And you can post it, is that in the permit very clear? Is that in the posting when whoever is running the event has to make the announcement to the community? I think that makes it a little bit easier and more manageable.
If I may I just add that enforcing, making it very clear and educating on the decibel level, there was never really any objection to having amplified sound that was within the New York City Noise Code, right, which is 85. And that's really where the problem has come. It was just like, put it at this level that is not so disruptive. As you know, it's been documented, many of the events have been over 100 decibels and for periods of time. And if that was, stipulated, right? And I think it has the noise code stipulated in the resolution, yes?
No, actually, no.
Actually,
No.
no. And I'm missing this, and it's on my note. When we had the presentation last month by EDP that lasted like 2 hours, we need to learn something from that. I mean, I think
The app, I like the app.
I think that the app, for instance, but also having someone explain to us for over 2 hours what the level is and whatnot, that should give us the solid ground to say, instead of defining sound, amplified sound, because people can use an amplified sound and lower the volume of whatever, whatnot. But to say
Okay,
between
right,
what
okay.
decibel,
Okay, okay.
no more, no
Okay.
higher than.
No, I mean, that's a good point. But of course, the downside is that nobody is standing there with a decibel meter
Well-
and is actually recording it. But now you can get it on the phone, right? You can
Yes, there's a-
Yes,
You-
you can. And you have the app that you can do it. In fact, we also, had made a request. We talked to our council member, Carmen De La Rosa, about getting, sort of like a monitor, a sign that could read it and monitor it. And, it got pushed back a year. She asked about funding for
Okay.
that.
Okay, but this DEP app, the noise monitoring app, records the decibel level.
That's right.
Yes, and also if the plaza, if each plaza has a manager and the manager is there when there is an
Yeah.
event,
Mhm.
they are responsible
Yeah, yes,
for
okay,
enforcing
okay.
the decibel
Right.
level.
Very good. No, I agree, yeah. So Nancy, are you suggesting that when we talk about amplified sound, we should make it clear that we're talking about amplified sound exceeding 85 decibels?
60.
Not
even-
exceeding, yeah.
Not
Not
exceeding, yeah.
exceeding 80, yeah, obey, in compliance
no.
with the New York City Noise Code, which is 85 decibels.
But and in that case also, in a way, having the decibel levels of the noise, you don't even have to necessarily deal with whether it's amplified or not amplified.
Well,
Yeah.
but I mean, really, and realistically, you're talking about amplified sound because it's,
Yeah, you're naming
unless,
it, but it's really-
unless you got somebody who can really scream very loudly, yeah. Okay, well, that's amplified. So what we should make clear that when we refer to amplified sound, the amplified sound we want to restrict is amplified sound that exceeds 85 decibels.
Or less, I don't know. I mean, I don't know what we can enforce because as Nancy was saying, on a quiet community,
Yeah.
65 is high enough. Maybe
Yeah.
we want to have a little bit more understanding of
Mhm.
giving the
Say
effect,
55 is what I
giving
thought.
the effect
Yeah.
of the decibels on children. Do we want to say 65?
Yeah.
Or more than 65? So how
All right.
does 65
Okay.
looks like when it's a concert, whatever it is? I don't know.
Well, something I can like consult with DEP to see what they believe is appropriate. But Nancy, are you what are you recommending here? Are you recommending that the limit be 65 or 85?
Well, I would recommend compliance with the New York City Noise Code, right? Now that, there have
that-
been discussions and that's 85.
Well,
Can we
well
say
then,
65
okay.
child safety issue.
Okay.
and
Yeah,
so
but
it-
then we
No,
it's
but we
the risk of being gray area.
Yeah, yeah.
We want
No,
to
no.
have something that is enforceable based on what is the.
yes, exactly. Yeah, we need to we need to conform with the New York City Noise Code. So that if they say 85, then we have to say 85.
If you have to put, air plug to
Whatever.
bring it down, then
Okay.
that's what it is, but. It's looking better, Steve. We are getting there.
No, this is a good suggestion because this is a good suggestion, but but even at 85 or below, you don't want an excess of amplified sound right outside your window.
I know,
Yeah,
but,
but-
that's the same. Instead of saying 4 hours and then people can play with that 4 hours from, 10 in the morning until 10 at night because, well, I only did it from,
Okay.
11 to 11:45. Now I
Okay.
have still
Okay, but what about, I think you had an idea earlier that we should say that,
no earlier than 10 a.m. or
or
whatever.
well, how about not earlier than noon?
Or no, I'm just making up a time because
Well, no, but what's the
But-
time that
I
you,
would say no earlier than noon, so people had the opportunity to do,
Hmm.
whatever, I don't know. And then no later than whatever the time is. But also Nancy lives in that neighborhood. She knows when things actually start or not. So she has a better sense of what is the timing.
Yeah.
But I also think that something started at 10 a.m.,
10 a.m. is early.
is
and,
kind of early.
and on weekends, some people like me like to sleep late.
I think we all. But
So-
you know, a window of time that makes sense. I don't know if you want to do a little bit of a survey between
yeah.
the, you know, the residents and figure out what that looks like.
yeah.
But then again, it's not just for the plaza where Nancy lives. We are listing all the plazas.
Yes,
and
I know.
Reform.
But I think, you know, I don't know, Nancy, what do you think about this idea of us, of stipulating that the amplified sound should, that there should not be amplified sound before noon?
I think there are a lot of people that would agree to that, especially on weekends. We have had events that like radio broadcasts and things that were at 7 to 8 o'clock in the morning, quite early. Those were mostly done on weekdays, but still, right? It's
Yeah, that's a
a
little
lot.
much.
It's a lot, yeah. And they were short-lived, but still,
Yeah.
yeah. So yes, I would say a time, yeah, giving a time frame, right? So between 12 and 8.
Yes.
I don't know how would one then, if you're not going to stick to a 4-hour limit, prevent an event from happening all day that was at the top at 85 all day, you know, for that whole
I know.
period of time.
Yeah.
That would just be unbearable for
Yeah.
residents.
But Nancy, part of what we are saying is putting a limit to those decibels and then having people to enforce that. I mean,
Yeah.
I think we need to have a conversation. I don't know if it's a conversation with the plaza manager or with whoever oversees the plaza manager to discuss how they can help to enforce this. So it's not something that is necessarily detached, but that is a more cohesive and collaborative effort.
Well, and there was one other thing that's applicable here is some of the permits. So some of the permits are issued through the managers, through the nonprofit, right? That manages. But
Yes.
SAPO can issue their own. And we were told that when it's SAPO, it's not their responsibility. It's SAPO's responsibility. And we were told that SAPO said they always have somebody there to see that things are going right. That hasn't been the experience.
Well, I mean,
So then there's kind of like a bit of, you know, someone not taking, you know, pushing the buck around as to who's responsible.
right. Well, the impression I get, what I've heard second or third hand, is that SAPO has said to our board that in the absence of our passing a resolution, they don't seem to be that committed to you know, in enforcing any particular policy, and apparently maybe not committed to providing us with advance notice of the events. So that's another reason why I think having this resolution is
But I
important.
think we are closer than we were definitely last month. And it would be,
Are you going to vote for it?
we made the changes that I'm making, yes.
Okay.
Okay. And I also heard this from SAPO too, Steve, that they directed us to go to the community board and get a resolution.
Right.
And then they would come in,
Yes,
right?
that's it. Yeah, yeah,
They
that's what I
wanted
was.
the guidance from the community
Yes.
board.
Yeah, that's what I'm referring to.
Yeah.
And that's why we brought this issue back to the front burner so that we could try to pass this resolution.
Yeah, and also, you know, one other thing is, I know you said you are not certain, Steve, whether having events at the plaza benefit small businesses. They do.
Oh no! Oh
Because
no! Oh
if
no!
you
No! No! No!
lose
No! No!
A lot of
Uh,
business
no, no.
then, and as someone who is
No,
on the
No! No!
business development committee,
Yeah, no.
you know, I
No.
cannot
Oh, if-
detach the two things.
No,
And
no, no,
also,
I understand.
Small
Yeah.
businesses are a very
no.
important fabric of our
Oh.
community.
No, no, it absolutely, if I gave you the wrong impression, then I certainly with Cascaya Plaza, it's very clear that the plaza was created largely to benefit the businesses on that street. That is no question about it. That's not necessarily the case with the others, but yeah, but certainly with the with Kaseya, what I was sort of had some hesitation about was the idea that the events on the plazas generate revenue for the city. Well, I guess to the extent that they generate revenue for the businesses, that there are sales taxes and other
Yeah.
things. So yeah, so there is, okay, I take it back. There is revenue generated for the city. Okay.
Then the other piece was the weekend.
Well, what I agreed to do with the weekends is to say that there should not be large events back to back. Because what we heard is that people like to relax at least one day on the weekend. You know, having these big events back to back is it means that they don't get any relief at all. They don't get a chance to have any quiet at all. So they came to our hearing a year ago and they said, please, the back-to-back events are too much. But with Kathy's suggestion, I modified that to say that you should not schedule two, large events. So you can have a smaller event. You can have something maybe geared towards kids, and then have on one day using amplified sound, but not have a big concert, but not have a big concert the next day. Okay, can you live with that?
Yeah.
Okay, very good. All right, Richard.
Okay, we can start voting and then we can come back.
Yeah, as soon as he comes back.
Or we can move to all businesses because it's
Oh.
about 10.
Okay, Richard, is there a motion on whether to adopt this revised resolution?
Motion.
Is it seconded?
Yeah.
Hamburg seconds?
Yep.
Okay, all those voting yes on the resolution as amended, that's 4. So 0-0. Are there members of the public who wish to vote on this resolution? Please indicate by raising your hands. I see 2 hands. Okay, very good. Is any member of the public voting no? Sherry Leone, are you abstaining?
She's not talking.
Well, I'll take that as an abstention. Okay, all right, so this resolution passes.
No answer. We can take it as yes, no obsession. We don't know what he's saying.
Well, if you're not voting, that's an abstention.
Mm.
That's the definition of an abstention. It's not like she's being identified. I'm not singling her out in any way. It doesn't. It's not.
Let's move it.
Okay, let's move it. Okay, so this resolution is evidently now going to go before the executive committee, although I'm not clear on how that process is going to work out. Okay, next on the agenda is old business. Any other old business?
I just want to raise the issue of the viaduct on Riverside Drive West. It's really, the building there is no emergency access to a building that have over 500 residents. There is no way whatsoever for any emergency vehicle, whether it's fire department, ambulance, whatever, to have access to that building. The 3 fire hydrants are completely blocked for any immediate access.
It's a long time.
It has been over a year, going to 2.
Oh, longer than that.
Yeah, longer than
I mean,
that.
for the project itself has been going on for years.
The
But
project is 7 years
but right now there's been no activity whatsoever
for 2 years.
for 2 years. And there's a rally on the 13th.
Yeah.
Yeah.
I don't know how we can raise that up, but it's really is a disaster waiting to
Right,
happen.
right.
It's a death trap.
Just for my information, which one?
The one fully blocked is River Arts, is the last building on Riverside Drive West,
Yeah, it's 159-00.
and then 2 more others.
Yeah, okay, but yeah. Okay, any other old business? Is there any new business? None. Any other announcements? No announcements. The next meeting, we are supposed to meet as a joint we're supposed to have a joint meeting with the Traffic and Transportation Committee on July the 15th, dealing with a variety of parking issues, apparently including the question about the efficacy of the alternate side of the street parking reduction that this committee moved for, oh God, I don't know, about 15 years ago.
So are we all supposed to go to that one?
It would be nice. It's not, we don't have a location yet.
Steve,
Yeah, it may be at the Y.
I'm gonna ask this just in a quiet, professional way.
Yeah.
Why is that meeting happening?
Because there have been an assortment of parking issues that have come up in recent months, and including this one about alternate side of street parking. But it goes beyond that. I think we're also dealing with I don't know, maybe the impact of congestion pricing, maybe some other issues. I'm not clear on what the other issues are.
In our neighborhood, a lot of New Jersey cars come over the bridge, park, and so then our people can't park, and then they take the A train to work.
Yeah.
And that's congestion price.
And is it the transportation committee requesting that?
Well, they were saying that they were going to hold a hearing. Anthony has asked us to hold a hearing on this other alternate side of the street parking thing. On alternate side of the street parking, apparently the impetus for that is largely coming from the sanitation department, which is upset that people are not moving their cars. So they're looking for some support on the idea that there should be increased enforcement against the people who don't move their cars.
Is it in any way going after the resolutions of a while ago that shifted us to 1 day a week?
No. I think we've clarified that nobody wants to go back to having a twice a week alternate side of the street parking.
It's essentially, and I mean this nicely, because there may be some good issues in there. A catch-all of traffic and parking issues sort of
Yes.
thrown into
Yes.
one summer meeting.
Yes, it's definitely that. It's definitely a catch-all.
I offer no warmth towards the idea, but we'll see what happens.
Okay, but to the extent that people can come to that meeting on July 15th at a place yet to be determined, well, I assume it'll be, I don't know, it might be 6:30.
If they did go home some of the meetings.
Okay, but you might have to just go, have one night. Okay, so
There's an answer.
Okay.
Okay, so we're gonna adjourn this meeting at 9:51 PM. Want to thank you for coming.
Thank you.
And-
Thank you, everyone in the public for staying.
And thank you, committee. Thank you for your time. Appreciate you hearing me.
All right, very good. Thank you, Nancy. And Jennifer, I apologize for not noticing your question earlier. I'll try to get you an answer.
All right, A train here.
Well, hopefully by now it's working.
We're gonna get going.